we have a specialist in cardiologist. He does a lot of good, fancy stuff that I'm scared to do it myself, which I've never done it before. He's going to talk to us about obesity and cardiovascular issues. This is one of the new episodes of G&T. Welcome. Thank you for being a part of this. If you could introduce yourself, kind of tell about yourself, how you end up where you are and what you're doing, would be awesome.
Sure. Dominic Robine is my name. I'm an interventional cardiologist in Las Vegas. About 6 years out of practice, out of fellowship now, so I'm still fairly new in my career. But my personal kind of journey into this realm of intermittent fasting and just diet and general lifestyle is a very personal one. I found myself, doing STEMIs and treating these acute MIs, and I'm morbidly obese. I'm, 247 pounds at 5'10", unable to keep up with my family in terms of activities and whatnot. I'm a total hypocrite, speaking to patients about health. So I completely changed everything, and I kind of got my life right and lost about 90 pounds through intermittent fasting, various diets. I played around with a lot of stuff. And that just, that kind of got the ball rolling with my interest in this whole space, which we learned zero about in training, zero. I personally didn't have any training in nutrition or, health span. So yeah, that's
Perfect. Dr. Robine, thank you for joining us again. And, what you touched upon is actually important. I always say that it's important for patients not to forget that we're humans too. They will probably catch me in some restaurant here in Orlando, also eating unhealthy foods on weekends here and there. And I always say it's also it's important for me to feel that as well, to see their struggles, because I also go through these struggles myself. It's, I'm not one of those people, I think, like you touched upon as well. And I think Dr. Teixeira is not either. There are some people who can eat whatever they want and they never gain weight. For me, it's never been the case. If I really go on vacation, I always gain almost immediately a few pounds extra. And I know how hard it is to shed those even 3 or 4 or 5 pounds. And so I know how it is and I can only imagine what it feels like for a patient to lose 100 pounds or 50 pounds. And our patients are probably, most of them are much more strong-willed than I am, because most of the time they do it with diets. Most of the time they end up gaining it back, which is really something that we see often. Those diets are not sustainable, but they tend to do it. So yeah, for sure, the struggle is real, and we feel it too. One question that I wanted you to ask about: what diet do you recommend for your patients nowadays, and do you feel a difference with this current diet than previous diets in the past? Because this seems to be something that tends to change often, and there are diets that get trendy and come and go. So what is your take on this?
Yeah, I mean, it's a good question. I don't think there's a right answer to it. It's just so dependent on each individual patient. My personal experience with keto, I had a lot of success with that. With I did carnivore for 30 days just to see. If I just tell patients, listen, if you want to do a keto diet and you're a carb person, you will fail. It's just not sustainable. I think a Pesco-Mediterranean diet is probably the easiest to follow long term. It's very sustainable, and as we were talking about, it probably tastes the best. I think though, if you right. I honestly think though, if you add a component of intermittent fasting or time restricted feeding to any diet, I think people will see success over the long term.
Yeah, so I think that the fasting, right, the 16-hour fast, that I agree with you, man. It doesn't matter what diet you do. If you add that component to it, it's going to make you lose weight. But in my mind, the ketogenics, right, or in lame terms, the burning of the sugar that we have, the alcohol and so forth, right? It can only last so long, right? It's not sustainable that 16-hour, 12-hour, non-eating, so forth. And I agree with you, like I'm a carb guy, so I have to stay away from carbs, right? So if I do a keto, it's a disaster. I mean, it's not going to work for me because, I mean, I'm going to be miserable, right? And if you look at it, uh, probably one of the oldest diets. So my dad is a endocrinologist. I remember him talking about the Mediterranean diet when we were little. So it's the diet that has been around the most, right? And he hasn't failed, right? He hasn't failed. And it's important for our patients, right? Because some of our patients, they do the bariatric surgery and think, okay, I'm good. I don't need to diet anymore, right? No, you still have to do your diet because you still have your comorbidities, meaning your cardiovascular disease and so forth, right? So you still have to make those changes to be able to improve your cardiovascular issues. And that's why I think it's the beauty, right, of the bariatric cardiovascular disease, what you do in diet. It's all combined into one thing, you know. Yeah. What is so one of our cardiologists here, actually we have a pretty large cardiology group here in Orlando, in Orlando Health. I think right now we are up to 76 cardiologists, so it's pretty large. Yeah, it's pretty large, man. They do everything here, which is great. So our referral patterns, it's whatever you can imagine from cardiology perspective. And a lot of them that have overweight or obese patients with atrial fibrillation, the first thing they've been doing now is sending to us for weight loss, right? What is your take on that?
I'm a huge proponent of bariatric surgery as an option. I think it's underutilized. A lot of these patients are so far behind the eight ball that they're not going to be able to get to their goal metabolically without some help. But I think the idea of setting the foundation before the surgery is what's needed for success after surgery, like you were saying with the diet. Getting the diet on point, finding out how you're eating, what your eating patterns are, what you like to eat, what diet's not going to work for you before the surgery. You'll have success afterwards. Otherwise, as you know, it's not going to work. So yes, I send a lot of patients to bariatric surgery, not with the expectation that they're all going to get surgery, because some of them won't, but a lot of them will. And it just metabolically, from a cardiovascular standpoint, I mean, the data is very clear that that kind of weight loss is majorly impactful on the heart.
Right. And it's really a two-way referral pattern if you look at it, because a lot of the patients like Dr. T and yourself touched upon get referred to us by cardiologists because this is one of the most important things, right? Heart disease can kill you, and it's very dangerous. And even though, we want also to get rid of your high blood pressure, your diabetes, which also affects your heart, of course, in an indirect way. And but also this, cardiovascular disease or heart disease can kill you almost immediately. Obesity increases the risk of sudden death, of having heart attacks, and so on and so forth. But also, we end up sending a lot of patients to cardiologists as well prior to surgery to make sure that it is safe, given that this is an elective surgery, that it is safe to do so, because this is not something that we want to tamper with, and we want to make sure that we have our I's dotted and T's crossed before we proceed with surgery. So tell us, how do you see the reduction in the risk of having both coronary artery disease, or in layman's terms, really heart attacks, and also the other thing is heart failures with weight loss and bariatric procedures?
Yeah, the vast, I think we have to remember, the vast majority of patients that get into trouble with heart disease, heart failure, with weight-related issues also have comorbidities that go along with the hypertension, the diabetes, the dyslipidemia. It's not to say that you can not have those conditions and you still get coronary artery disease. But so it's really reducing the weight, and this is all getting back to, I think the key, the bond between us all is the endocrine system and the gut, probably. But there's no question that with weight reduction comes improved blood pressure, improved glycemic control, and subsequently a reduction in the risk of heart disease, heart attack, heart failure, that kind of stuff. So yeah. Does
Yeah,
that answer the
so this
question?
is good. So we have, like I said, we have a very large cardiac group here, and also the same token, we have a very large cardiac surgery group here because of one go hand to hand, like you said. So now the biggest thing that we're starting to do with them is patients that have congestive heart failure. They are on their end of the heart function, right? And they have to put, on lame terms, a device that helps pump called the LVADs to a certain degree. So just to be easier for the people to understand, it's a device they put in the heart that helps pumping the blood, right? So we are actually we're going to start performing sleeves on those patients, right? So they can become candidates for a cardiac transplant, right? And it's interesting, right, that some of those patients, if we had interacted with them before he got to that stage, maybe we could have aborted or avoided a cardiac transplant to a certain degree. Because you probably have seen way more than that we have, patients with cardiac failure that once they have the weight loss, a function of the heart tends to come back pretty decently, right? They have, yeah. So it's the connections there for sure between the two specialties for sure.
Right. Right.
What?
And that's why it's important for those patients that are beforehand to remember that even if you feel well now, diabetes, you don't feel any pain with that. High blood pressure, you feel any pain with that. But it is important that you seek the help that you need with your weight, the bariatric surgery, before you reach to that point where it's going to be much harder to do something on you because of what Dr. Teixeira and Dr. Robine mentioned, but rather before when you get there so that we can do it so that you never get to that point. And that is something that I think is key for patients to remember.
What do you think? I know there's this new fad that people are doing. It's called the water diet. People just
Yeah,
do 2 days and drink water.
I don't know. My answer might be a little bit surprising. I don't. I think if you've had a discussion with your physician and the physician understands what's going on and can monitor them, I think some prolonged fasting can be very beneficial. I'm a big proponent of a time-restricted feeding pattern. 16 hours of fasting, if you want to call it fasting, and 8 hours of eating. I think that's easy to do with some practice. Maybe start with 12 and move up. Ultimately, I follow a non-negotiable 16-hour fast every day. But I do throw in prolonged fasting. I do a 24 or 36-hour fast. Usually 24, maybe once a month, once every 6 weeks or so, and then I'll do a 36-hour every quarter, once a quarter.
Why?
I don't think that's safe for everyone.
Yeah, I know. I 100% that's not for everyone. But why is it that you do? Just for my own learning and for everybody to learn, what is the benefit of throwing that 24 or that 36? Is just to shock and awe the body, or?
Yeah, and it might be getting into the weeds a little bit for the audience, but it's there is a phenomenon, this cellular autophagy, which probably doesn't necessarily happen at a shorter fasting period of 16 hours. Maybe it does, but it's clearly 24 is beneficial. So just reducing inflammation, truly allowing the gut to rest. For me personally, I find that if I'm ever struggling with like a plateau, energy-wise, weight-wise, that a prolonged fast can really help. I don't think it's certainly not a necessary thing for everything. No, you don't have to do this to lose weight. You can do this with a shorter fasting time. But I just find that the focus that I get from a 36-hour fast, the energy, is just, there's nothing like it.
I mean, that's good. That's awesome. I mean, I think we should try anything that works for you, right?
Yeah.
It's
not for these diabetic patients
100%
on insulin. It's not a good idea.
Yeah.
Talk to your doctor
fasting is not for diabetic patients for sure, and definitely not for bariatric patients, right? Because they can have pretty bad issues, right? But it is a tool for sure that you can add on your armamentarium, right? And I've done it. I've done it at 12 hours. I could never get to 16 hours. Just because I do take diabetic medication, so it's kind of hard for me to do that. I start getting a little loopy, So for me, it was just not possible. But that's good. I mean, I think it's important. I think anything that you can do to decrease the inflammation, that's the key, right? Without getting into nuts and bolts. Once you decrease the inflammation, that's what happens with obesity, right? As that body ache, the joint pain, that quote unquote fibromyalgia that people tend to have when they're obese, once they lose their weight, all of that goes away, right? You decrease the inflammation status of the body, So for sure, I agree with you.
I think it's probably hitting on the gut in some way. It's just the gut rest, the gut microbiome in some way. I'm not an expert in that, but it's fascinating.
Right. So, Dr. Robine, I wanted to ask you about Mediterranean diet. As somebody that comes from Jerusalem, which is definitely Mediterranean, first of all, there's a lot of confusion between Middle Eastern diet and Mediterranean diet, and they're not the same. Middle Eastern diet is carb heavy and tends to be not that healthy. Unfortunately, still very tasty, mind you. And Mediterranean diet is definitely healthier and very tasty still, but can you explain to us what does Mediterranean diet entail? What is it about Mediterranean? What is Mediterranean diet first of all, and why is it so heart healthy, and why do you recommend that?
Yeah, I mean, just in general terms, it's a diet that you think about people in that area eating and drinking red wine, right? It's really focused. I break it down to the simplest term. It's broken into just fairly whole foods. It doesn't demonize fat as much as some of these other diets do, and some of the other diets promote heavy fat. But it's really focusing on healthy fats like olive oils, avocados, nuts, seeds, particular nuts and seeds, healthy fatty fish like herring and sardines and mackerel and salmon, and really building kind of the plate around the vegetables, the cruciferous green vegetables. That's just the general idea, and then incorporating some fruits, like maybe seasonal fruits, into the diet. I think my personal opinion on that is, I think I time my fruit intake and carb, more whole grain intake with times that I know I'm going to be the most active, and I can burn those calories off. If I'm sedentary like today in the office, it's going to be a lower carb day for me. I'm not going to eat the whole grains. I'm not going to eat the fruits, but I'm going to eat fat. Yeah.
Fair enough. And for those really, for example, for myself, that come from a Mediterranean region, we are definitely obsessed with olives and olive oil. I'll tell you that much. I can tell you that I've had my olive oil shipped from my hometown of Jerusalem to here because I'm so particular about it. And I think I bought Dr. Teixeira a bottle that he tried it. Oh, I don't know if he tried it.
Oh yeah, I mean,
so you can't accuse me of not having it.
No, it's challenging to find really good olive oil.
Mm-hmm. Yeah, it's phenomenal. Yeah. But he gets these big jugs. I don't know how he does it. He comes straight from Jerusalem. I don't know how he does it. But listen,
we don't talk about it. It's the secret.
It's the secret. I want to ask you this.
Yeah, exactly. Can't tell you.
How is it that you maintain yourself so passionate after, I'm 11 years after my fellowship, right? I'm very passionate as I was in terms of bariatrics and what I do. Have I discovered other things within the field that I'm very much so passionate about? 100%, right? You started to kind of tunnel it more and discover what your passion is. And so how do you do it? How do you stay yourself so passionate, right? For what you do and how you see it tunneling more like most of us tend to do.
Yeah, but I think a lot of it has to do with the fact that it's all very new to me. It's not. I consider myself a lifelong learner. I enjoy learning new things, and this was a completely foreign and new topic. As embarrassing as that is for as physicians for us to say that we this is a new topic, but it really is. I had no knowledge of nutrition at all, and I just found myself dabbling in little things here and there with the diet and finding just tremendous personal benefits, and that just fueled the passion more. But yeah, I'm definitely becoming more and more focused on that pathway. I really enjoyed in the beginning of my career the middle of the night, wake you up for a STEMI for a heart attack. You come in, you fix it at 3 a.m. You feel like Superman, and in the end, I felt like that was less impactful than me being able to really help a patient understand the process so that they're never in that position where they're having a heart attack at 3 a.m. That to me was just surprising that is my passion, but it really is now.
That's awesome. I think we all have the same thing, right? I agree with you. When I came out, that night call comes in, you go in, you help the patient operate it, fix the problem, you feel this is great. But then you should start to evolve, right? To maybe I can do something that we can prevent all of this happening. And I agree with you. You start, like I said, a life to learn, right? You're just always learning, right? And one thing that I teach, I try to teach my residents and fellows, and one thing that my dad taught me was, if you're getting up in the morning and you're not happy, or you say, oh, I'm going to work, that means you're not doing something because you truly like it, right? If you wake up in the morning and say, I'm going to have fun, I'm just enjoying what I do, it's not work, right? Then you actually chose exactly what you wanted to do in your life, right? And I feel that way. I know Ghana does the same. You're talking to, I can see the same thing. But you're still learning, man, still learning. It doesn't stop.
Yeah, it's just fascinating. The whole field to me is fascinating, and I find myself, more. I enjoy work so much more now in this kind of niche than I did doing the middle of the night kind of stuff. So I'll stick with it as long as that lasts.
Nice.
That's good.
Yeah. So, what do you recommend for a patient to stay motivated and kind of diet-wise at least, and to keep that healthy mindset? What is your the pros and kind of tips and tricks that you give them to stay on that track?
I think one of the most common questions I get is what do I do? What do you do? Well, I can tell you what I do, but it's very unlike. It might not be anything that's going to work for you. So, when it comes to exercise, I tell patients, find something that doesn't feel like exercise that you like doing. If it's standing on your head, stand on your head. Do whatever you feel like you like to do. And with diet, it's the same thing as we were saying before. It's not necessarily, oh, well, my cousin did keto and they lost weight, I'm going to do keto. Look, if you like pasta, it's not going to work. It's just not sustainable. So I do try to individualize it with each person. And it becomes a little bit of homework for the patient to figure out what exactly they like, what they don't like, what's going to work for them, and a little honesty with themselves. But my general rule is we've got to move more. And I think the 10,000 step rule, it keeps getting bumped up and down. And I think that's a very basic thing, is get some steps in every day. It's so basic, but it can be just tremendously beneficial. That's going to allow some room for you to enjoy some of those foods that, would be harmful for you. Like, the carbohydrates for me, I use those carbs. I time them out for when I'm going to be active. I use it as kind of a little treat. So I try to help patients find those things that they enjoy doing that can allow them a little bit of wiggle room with the diet, and then I really push the fasting as much as possible. Once they start seeing little benefits and little tiny goals, maybe it's I walked 5,000 steps today, I'm going to walk 100 tomorrow. It just seems to build on itself, and then they get self-motivated. The ones that really are going to succeed get self-motivated.
True. So listen, man, thank you so much. I appreciate it so much for your time. I know you're busy. I just came back from Vegas. Actually, I was in Vegas last weekend. Therefore, we have a meeting there, American Society of Metabolic and Bariatric Surgery at the Mirage. It was a smaller meeting because our big meeting is in June. Yeah, July in Dallas. But anyway, thank you so much for your time.
Hopefully, you got some good weather.
It was kind of chilly though.
Yeah, it's been cold. It's been, a little chilly for Vegas, but nothing like Orlando.
No, Orlando's been ridiculously cold here, man. I mean, 2 days ago it was 36 degrees.
Is it?
I mean,
that's too cold for me. Yeah.
That's too cold, right? So
anyway. I was born in Florida, so I do know that I remember the humidity and the heat and
right.
And
where in Florida? Where in Florida?
West Palm Beach.
Oh, West Palm Beach. Yeah.
Oh, nice.
The difference between West Palm and Central Florida, two different things, right? One is the amount of money that's made in West Palm, and then here. At West Palm, you have the cool breeze coming in from the ocean. So even though it's the same temperature, but the humidity is not the same as here in Central Florida, because the humidity here makes a killer.
Yeah.
But anyway,
yeah.
Thank you so much. Okay, appreciate it so much for your time.
No, it's my pleasure.
Hope you are.
Thank you for coming, Dr.
No, thank
Robine.
you very much. Appreciate it.
Thank you. Have a good night, man.
Take care.
Take care.
See you guys.
See you guys.